My name is Lisa. I'm 59 years old. I've been married to my husband for 12 years. I retired in July, and so we've been spending a lot of time hiking, camping, kayaking, biking, golfing. We're pretty active people. I have never had children of my own, but I have 2 stepchildren, and we have 5 grandchildren, so that's also fun. We spend a lot of time with them. I started approximately late 40s with menopause, and at that time it was just some varying symptoms. It wasn't too bad for me. And then as I got closer to probably 54 or 55, I started experiencing some difficulty with sexual intercourse, including pain, dryness. Just was not a comfortable situation. For me, my husband was very understanding, but I didn't know if this was a normal process or if there was something wrong with me. I had worked with my primary care provider, and she even got to the point where it was difficult for her to do a vaginal exam because of the condition of my tissues being very irritated. And through then, intercourse became more difficult, more painful, and it was starting to wear on my relationship with my husband. He was very understanding, but it still was a little bit frustrating for us when we were having sex, and it felt defeating and just kind of like I was letting my husband down. So I knew of Dr. Dupree through the hospital that I work at, and I had mentioned to her that I would potentially go see her because of some of my symptoms, and we were in agreement, and she said that maybe she would be better at getting that pelvic exam. So that appointment was like, whew, things can change, things can get better. So I met with Dr. Dupree, and I talked about my symptoms and concerns over what even is available for women. And I have family history. My mother had breast cancer and my aunt had breast cancer. So, with everything that I've read to this point, I was worried about hormone replacement, what would be my risk of developing cancer possibly, what was available for prescription, what was available over the counter, since I just used like basic over the counter lubricants. They were short acting. There was some varying relief, but the pain was still there. And she was very enlightening, very educational to my body, the changes, what was happening through menopause, and it just was like, wow. And then she talked about different options that we could pursue to make things better. We settled on Osphena, and I started on that daily, and for me, about 4 weeks into therapy, I started noticing some improvement, less painful intercourse, better lubrication, and she had prescribed also a pain reliever cream, and I found that I could back off from that even more because I wasn't experiencing so much pain with intercourse. I've now been on it for approximately 5 years, and things are great with us.
When discussing treatment options for painful sex and/or vaginal dryness, ask your doctor if Osphena is right for you. You can also find more information at osphena.com.
Important safety information, including boxed warning and indication. Indication. What is Osphena? Osphena is a prescription oral pill that treats moderate to severe painful intercourse, moderate to severe vaginal dryness, symptoms of changes in and around your vagina due to menopause. Most important information you should know about Osphena. Warning: endometrial cancer and cardiovascular disorders. Osphena works like estrogen in the lining of the uterus, endometrium, but can work differently in other parts of the body. Taking estrogen alone, or Osphena, may increase your chance for getting cancer of the lining of the uterus. Vaginal bleeding after menopause may be a warning sign of cancer of the lining of the uterus. Your healthcare provider should check any unusual vaginal bleeding to find out the cause, so tell him or her right away if this happens while you are using Osphena. Osphena may increase your chances of having a stroke or blood clots. You and your healthcare provider should talk regularly about whether you still need treatment with Osphena. Call your healthcare provider right away if you have unusual vaginal bleeding, changes in vision or speech, sudden new severe headaches, and pains in your chest or legs, with or without shortness of breath, weakness, and fatigue. Who should not take Osphena? Osphena should not be used if you have unusual vaginal bleeding, have or have had certain types of cancers, including cancer of the breast or uterus, have or have had blood clots, had a stroke or heart attack, have severe liver problems, are allergic to Osphena or any of its ingredients, or think you may be pregnant. Tell your healthcare provider if you are going to have surgery or will be on bed rest. Possible side effects. Serious but less common side effects can include stroke, blood clots, cancer of the lining of the uterus. Less serious but common side effects include hot flushes or flashes, vaginal discharge, muscle spasms, headache, excessive sweating, hyperhidrosis, heavy vaginal bleeding, vaginal hemorrhage, night sweats. Tell your healthcare provider about all of the medicines and supplements you take, as some medicines may affect how Osphena works. Osphena may also affect how other medicines work. Duchenet USA encourages you to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For full important safety information, please see prescribing information, including boxed warning and patient information at osphena.com.